Hello, everybody. Welcome to our live show tonight, where we're going to be talking about the public option in Nevada. My name is Laura Packard, and I'm a healthcare activist. And 4 years ago, while I was living in Las Vegas, I was diagnosed with stage 4 cancer. I went through 6 months of chemotherapy and a month of radiation, and the bills were just enormous, even with good insurance. That's why I know how important it is for us to lower insurance costs for Nevadans, for people that don't have insurance or people that do have insurance through the exchange. And there is a bill right now in the Nevada legislature, the Nevada public option. It passed the Senate earlier this week, and it's on to the Assembly, to the Ways and Means Committee, which may hold a hearing as soon as Thursday. So if you live in Nevada, or if you have friends and family in Nevada, pay attention to what's happening in healthcare in Nevada and also in Colorado and some other states that are looking at a public option too. And we have a special guest tonight, Mayor Daniel Corona from West Wendover, who has a personal healthcare story and cares about this issue deeply because it could affect him too. He had the honor of testifying before the Nevada Senate Health Committee a couple weeks ago, and he is here to tell us about his healthcare experience, why he supports the public option, and why you should support the public option too. So without further ado, here's the mayor.
Thank you for having me. A little bit about, as Laura mentioned, Daniel Corona. I have the distinct honor and privilege of serving the people of West Wendover, Nevada. For those of you who don't know where West Wendover is, as I assume most folks usually don't unless you've been here, we are on the eastern border of Nevada. We share a border with Utah. West Wendover is west of Wendover, which is in Utah. We are a community of about 4,500 residents, very diverse community. The population is over 70% Latino. We have a lot of folks who live below the poverty line, who don't have, employer provided insurance or even healthcare at all, for that matter. And so this issue is something that I've always heard about in our community, but it's not always something that I've experienced myself personally. I when I turned 26, I was kicked off my parents' insurance, had to start finding my own. I oftentimes, through the Nevada Healthcare Exchange, was unable to find a plan with subsidies that I could afford. And so for those couple of years, I just went without health insurance. Luckily, last year, I was able to finally find a insurance that I was able to afford with subsidies. And it's a good thing that I was able to, because it saved my life. Back in July of 2020, I got really sick. I thought that I had COVID. Went to the doctor a few times, got tested. They all 3 times came back negative. But I was starting to get really bad migraines. I had always had headaches throughout my entire life, but they were never as bad as they started to be after July. And from July till about January, I was having a migraine every day from the time I woke up to the time I went to bed. But I really didn't think much about it. And especially, I signed up during open enrollment, so my insurance didn't kick in until January anyways. So I kept putting off going to get checked because I knew that in January I'd be able to go get checked. They'd probably give me some migraine medication. I didn't think it was that big of a deal. Well, in the beginning of January, I was in Elko going to the DMV. I pulled up to the DMV and my vision went completely black. I couldn't see anything for probably about 20 to 30 seconds. This concerned me, but I had thought, oh, I'm relatively healthy. I probably just haven't ate today. And so I'm going to be fine. I just need to go get something to eat. So I did my business at the DMV, and then I went and got something to eat. And when I got back in the car to start driving home, um, my vision started to get very blurry. And I started getting very dizzy and very sick. So I pulled over at a gas station thinking, oh, I'll just go in, get some Gatorade or Pedialyte or something, and I'd be fine. Well, I sat in my car and realized there's something seriously wrong. So I went to the hospital. And in the hospital, they immediately did a CT scan of my head, found that it looked like there was a lot of fluid on my brain. And so they did a spinal tap. And when they did the spinal tap, my pressure levels were nearly 5 times what the normal pressure levels are supposed to be of your spinal fluid in your brain. And as I was in Elko is a small regional hospital. They don't really have very many specialists. They certainly don't have a neurology department. So they had to fly me from Elko to Salt Lake City to the University of Utah Hospital to see a neurologist. When I got to the University of Utah, after the neurologist took a look at my scans, it was very clear that they were going to have to go in and do brain surgery. No question about it. There was too much pressure. There was no way they were going to be able to relieve it. And it looked like there was a severe blockage in my brain. So they scheduled the surgery. I stayed in the hospital. While I was waiting for my surgery, they did more tests to find out, if I had meningitis or what would possibly be causing the blockage in my brain to, allow this buildup of fluid. They ruled out everything that they possibly could rule out, and came to the conclusion that I was a very unfortunate person and born with a cyst on my brain. It happens to the doctor told me it's surprising how many people have cysts in their brain, but most people don't have any issues with it until they're well within, their 70s or 80s. I was 28 at the time, or 29 at the time, so certainly, much younger than the typical person that the neurologist sees with these types of issues. So they went in, did the surgery, were able to successfully remove the blockage and put in a drainage valve in the top of my head. So that way, if they ever have to go back in, they don't have to be as invasive. They can just link into the port in the top of my head through a needle and relieve pressure, and then also go in and try to remove a blockage again, or even put in a stent if they had to. That entire, stay in the hospital was about 6 days. And, my recovery time was supposed to be, a month that I was supposed to take off of work. I got home and maybe 4 days later, I had already got my first bill. I received a bill from the ambulance company who transferred me from the airport where I was flown into to the hospital, because my insurance had already denied that claim, which I don't understand, and at the time I didn't understand how, my situation was severe enough to be air flighted into Salt Lake City, but it wasn't severe enough for the insurer to cover the ambulance. And I later found out that it's because I had got my insurance through the Nevada Healthcare Exchange. So anything outside of Nevada was out of network. Anything outside of Elko County, for that matter, is out of network. So after fighting with the insurance, they still won't cover the ambulance. Another bill that I got that was surprising was from the anesthesiologist. My insurance, before my month healing time was even up, I was stressing out about hospital bills because my insurance was denying claims so fast because I was at an out of network hospital. For example, the anesthesiologist They didn't want to cover my anesthesia. You can't have brain surgery without anesthesia. They have to put you out. So the fact that because I was out of state, I had no choice in the matter. I had to be flown. It was medically necessary. I was looking at several thousands of dollars in hospital bills. Luckily, I was able to successfully um, appeal most of the claims and get my insurance to pay for them. But that took up time that I was supposed to be focusing on getting better. It
Mhm.
was taking up time where you shouldn't be being forced to stress out about how am I going to pay this bill. You should be worried about how am I going to get better, so that I can get on with my life. Another thing that the insurer was supposed to cover was my follow-up visits with my neurologist and my optometrist. Uh,
Mhm.
After my surgery, even after the month of when I was supposed to be better, I went back to the neurologist, had my checkup. Luckily, things were good there, but with my eyesight, I was still having episodes where my vision would go blurry. Um, so a checkup was necessary to make sure that everything was working the way it should and everything was recovering the way it should. Because a lot of times when folks have fluid buildup in their brain and they go in and drain it, the pressure being released so fast can end up damaging the optic nerve and causing blindness. And so I certainly wanted to make sure that I wasn't going to go blind. So I went to my ophthalmology follow up and later found out that my insurance decided that they wouldn't cover the follow-up visits, so I was stuck with those bills. That's part of the reason why I think that Nevadans and everyone, for that matter, deserve a public option. We need healthcare as a right and not as a privilege of something that only those who are fortunate enough to afford quality healthcare are able to have. It shouldn't also, my hospital bills, had I not had good insurance, would have been upwards of $500 million or $500,000. No one should have to have $500,000 just to live. It's ridiculous. We can do better. We should do better, and we will do better. Um, and the first step is through the Nevada public option.
Mhm.
Also, I want to just point out real quick that in 2017, on the Nevada Healthcare Exchange, insurers had notified the governor that they weren't going to participate for rural Nevada counties. Had that happened and they continue to not uh, have an option for rural Nevadans on the healthcare exchange, I wouldn't have had insurance this year. I would have continued to ignore, my health issues with my headaches and my vision, because I would have been worried about how I was going to pay for it. And when I was talking to my neurologist, um, as right as I was going into surgery, she flat out told me, the option is do the surgery or wait a couple months and die because the brain damage is so severe from that much pressure, that's what's going to happen. And so the Nevada public option will guarantee that rural Nevadans will always have an option when it comes to healthcare. Will always have access to affordable and quality healthcare, no matter where you live. And so it's so incredibly important that we get the public option through the assembly this week, and then continue to make sure that Governor Sisolak hears from all of us about how important this public option is so that he'll sign it and so that it will go into effect. And so, that's why I'm supporting it. And that's a little bit of my story.
Thank you for sharing. And as a mayor of West Wendover, do you have a lot of constituents that can't afford insurance right now that maybe a cheaper option would enable them to get covered?
Yeah. So when I was sharing my healthcare or my story of my brain issues, um, I heard from a lot of constituents who said, I've looked on the exchange. I don't qualify for any subsidies. I don't have insurance through work. Um, I can't afford to buy a plan on the health exchange. I heard from, several folks that said that they have no healthcare insurance because they don't qualify for subsidies. If they qualified for subsidies, they would buy a plan on the exchange right away. The problem is that the exchange is great for those who can qualify for subsidies, but for those who can't, the Nevada public option will help fill that gap so that those folks who still qualify for the exchange but may not qualify for a subsidy will still have an option that's affordable, and so that we can make sure that folks get insured, because that's the number one reason I hear from folks as to why they haven't bought a plan through the exchange is because cost is a barrier.
Mm-hmm. And it's great that in Nevada, there's now an opportunity to pass a bill that will help people, especially because the Nevada legislature was looking at doing something like this a few years ago. But I believe the governor, who was a Republican, Governor Sandoval, vetoed it. So that was unfortunate, but now there's a new opportunity to move forward and keep working towards healthcare for everybody.
Yeah, and I think that we've already passed it once, so it gives me hope. I know there's only a few days left in the session, that it can pass again, and this time a Democratic governor, and so I would expect that the Governor Sisolak would sign it.
Yes, but first it has to pass the Assembly. It's passed the Nevada Senate,
Yes.
but the Assembly has to vote. So please contact your Assembly person. Make sure that they hear from you and you want them to do something about the cost of healthcare in Nevada, specifically pass SB 420 and pass the Nevada public option. So is there anything else you wanted to add? Thank you very much for your time tonight.
Yeah, I would just urge everyone, as an elected official, I love to hear from, my constituents about every issue that comes before the city council. I have a lot of friends in the Assembly. I know that they like when they hear input from their constituents. So please, please, please email, call, fill out on the legislature's website. They have an opinion poll that you can fill out. Do all of those things. If you know your legislator personally, text them, and just let's get this passed, because it is, past due. We need to do something about the cost of healthcare in this country, and the Nevada public option it's not the end all be all, but it certainly is a very good first step.
Exactly. Well, thank you for your time, and thank you everybody that's watching, and be sure to contact your Assembly person as soon as possible, because the Nevada legislature adjourns on Monday, Memorial Day. So if you wait until next week, it will be too late. Thank you.
Alrighty, I think we're good.
All right, even though it says live, it's not actually live.